the Alliance, for this invitation. It's really exciting to be here. I'm Karen, I'm Chief Exec of the Pulmonary Vascular Disease organisation. And whenever I think of our name, it puts me in mind of a really big building full of laboratories and things like that, but nothing could be further from the truth. Actually, what we're all about people. We're a little bit like a learned society, if you know what I mean. So we bring together a global network of pulmonary hypertension physicians, researchers, industry, regulators, and they come together to tackle some of the most pressing challenges in PH. And because they're the experts, they're the best people to be defining what those challenges are and to be coming together to see how they can meet them. So this photo was taken at our most recent meeting, which was in Rio, and I'm going to come on and talk a little bit about that later. But to start with, I'm just going to tell you a little bit more about PVRI and who we are and what we do. We're not primarily a patient organisation. There are many wonderful patient organisations around the world, and we work really closely with them. They're doing great work, but we don't want to tread on their toes. We don't want to duplicate their work. We want to collaborate, not compete. So we obviously do involve patients in our work, because everything we do, the education, the learning, the research, it's patient involvement is only going to make that better. But I'll touch on that a little bit more as we go through. So how does our learned society work? Well, I think the strength is we pull together the skills, the ambition, the knowledge and the energy of this vast global network of academics, of clinicians, of regulators, patients, pharma, and they all have a common interest in PVD, but specifically in PH. And I think this is particularly seen in the work of our work groups. So we've got 21 different global work groups, very active at the moment, all over the world. We've got 8 work streams that form our innovative drug discovery initiative. Now, the idea behind the IDDI, it was to bring multidisciplinary teams together, crucially including pharma and regulators. Several also have patient involvement too, to try and improve the pace and the efficiency with which new treatments reach patients. So that was the reason why they were developed about 5 or 6 years ago. The groups at the moment include lung transplantation, clinical trial design, pediatrics, group 3 PH, and more. There are details of all these on our website. And a lot of our groups produce educational materials, mostly addressing the needs of PH professionals rather than patients. But it is worth mentioning, I mean, we do some patient-facing work, and our lung transplant work stream at the end of last year did a great webinar that's freely available. You can find it on our website. Patient-facing, all about lung transplantation. It was one of the most popular webinars of the whole of last year. So, and I think Sandeep Sahay, who's also presenting today, is one of the members of the leadership team for the IDDI work. So he's very involved in that. So thank you, Sandeep. The workstream also includes our patient engagement and empowerment group, and Matt Granato for quite a long time was one of the co-chairs of that group, and he's also presenting today. He's going to tell you about this fantastic global patient survey that the group ran over the last sort of 2 or 3 years, and it started to produce some really juicy data about what patients' views and needs are. So that's really exciting, and Matt's going to talk about that later. We also have regional task forces. So we've got groups in India, China, Saudi Arabia, and the Middle East. We've got a new-ish, but newly invigorated Latin American task force, which is, it's got some real energy behind it at the moment. They're doing some exciting things. So a lot of the groups, the regional groups, are focusing on health inequalities. It's a real theme that's starting to come out of a lot of those work streams at the moment. This is our infection task force, pictured in Rio. They got together to meet up in person, which is brilliant, because most of the work obviously is done online. So it's great when people come together. The disease specialty task forces include infection, as I said, high altitude, and again, these are both fairly niche areas, really, both disproportionately affecting people in low and middle income countries. And again, the health inequalities theme, it comes out quite a bit in their work. One of the specialty task forces is called PHICON, which is the International Consortium for the Genetics of Pulmonary Arterial Hypertension. And this is a really successful network of centres that bring together research expertise and patient populations for collaborative genomic studies. And there's a really exciting ambition. They want to discover the complete genetic architecture of PAH. There are contributing centres, perhaps not surprisingly, tending to be in high income countries where there's a good healthcare infrastructure. So they've got collaborating centres in the UK, USA, Italy, Austria, in Germany, Canada, Belgium, France, and Spain and the Netherlands. And we've also got paediatric task forces too. So there's lots of collaboration in research supporting things like the development of guidelines that will raise care standards, and many of the groups publish papers and consensus statements and so on. So they're advancing the science, advancing the thinking in PH. And as well as collaboration, education is key to our work, and there are 4 arms to this, which are listed here. So we've got the journal, we've got e-learning, supporting research and collaboration in a variety of ways, and then the international meetings, which is the Congress is one. This is a slide just giving a brief overview of our magazine, our online peer-reviewed global journal. It's dedicated solely to pulmonary vascular disease and particularly PH. And it's freely available online. So if you do an online search for Wiley, which is the publisher, and Pulmonary Circulation, you can find all the latest articles on there. You can also get at them via our website as well. And what the website does is it'll point you easily at the latest ones, the newly published papers. Our e-learning is exciting, and again, freely delivered. So there are 3 different programs in our webinar series. The one, the image you can see here is from PVRI Digital, which it's quite a formal monthly curated series. 12, a program of webinars that runs across perhaps 12 or 15 months. It's put together by Patty Thistlethwaite and a committee. One has just ended, so they're busy planning the next one at the moment. And it was really exciting to see that this last series included a young investigator symposium series just for early career professionals, where they could present on a global stage. Another part of the e-learning is our community calls. Again, these are free. They're monthly webinars led by Jason Weatherald and Katrina Barry, who is on one of Hans's slides there. So there's quite a strong patient voice in the community calls. Sandeep, I think, is also involved in that committee, a man of many talents. So they tend to be, I suppose, slightly less formal, more informal, discursive sessions with a Q&A. Young researchers in particular present their recently published papers, and then there's a lot of chat and a lot of debate about it that's moderated by the committee. And then as well as that, we have a sort of ad hoc series that's run by many of our groups. So we have a high altitude series, as I mentioned, and a infection task force and the lung transplantation. So a lot of our groups are putting learning material out there as well. You can catch up with those online as well if you can't attend in person, because it's so difficult. We know with different time zones around the world, it's really difficult for everybody to access them in real time, but you can see them on our website on Catch Up. And we also access funds for collaborative international research. We provide travel grants to professionals to attend our own meetings and others. And the photo here is of Kyrgyzstan, where one of our recent grants was made to enable a high altitude meeting to take place there. We also funded a scientific meeting in India recently, and a meeting of the task force in Latin America, bringing people together from many Latin American countries to plan the next stages of their development work. So yeah, we also give awards, presentation awards at our own meetings to so people can showcase travel grants. Sorry, we give people travel grants to attend our meetings so that they can showcase their work and present. And this a video, and it's going to be really interesting to see whether it works or not. See if I can make this happen. Moving on to Rio. So this is a short piece from meeting that just happened in late January. And I don't think it wants to play. Oh, here we go. So,
Nice.
thank you. Cheesy music. I apologise for the cheesy music, but it was a fantastic meeting. What we try to do to make the model sustainable is to have a kind of a safe meeting one year where in a country where we're fairly sure to get a good footfall, so it might actually pay for itself. And then that enables us the next year to have a meeting in a country where perhaps it's, you know, we might not get such a high attendance rate, and we might have to subsidise it and make a bit of a deficit. But at least that way, if we move the meetings around the globe, we can make sure that we're more accessible. And it was brilliant that we had a really high attendance rate from Latin America in Rio. So we achieved that aim. We're going to Dublin next year, which I think and I hope will be really popular. So we're hoping for perhaps more than 500 delegates at that meeting. So that's our safe one. And we're busy at the moment consulting our membership about where to go the year after Dublin. So that can be a risky one too. I think that the Far East is coming out tops at the moment, but we shall see. So yeah, we were really, really pleased with the usual spread. We had delegates from many different countries, many different continents. The title of the meeting was Embracing Heterogeneity, and I think that is a really good title because there is just massive diversity in what we do at the moment, both in types of patients, in types of pH, in healthcare systems, and the types of treatment available. So we really do now, I think, need to embrace the fact that there's massive diversity in our field in a way that just a few years ago there really wasn't. And our board recently was discussing the pinch points in our scientific meetings, and just because they're so much bigger, there's so much more scope than there was a few years ago. So although we are the only purely pH global organisers of conferences, we can't please everybody. There's so much going on in our field at the moment. So I mean, we always get comments like there's too much basic science, or there's not enough basic science, too much paediatrics, not enough children. So, you can't please everybody. But I suppose we should be really excited about that. It means there's an awful lot going on. There's a high level of interest. There's an excitement in the field. So we're pleased, even if we can't please everybody else. And I think it's worth mentioning that we're really aware that our networks aren't equally resourced, as I mentioned earlier. Diversity and equality and inclusion are really important to us. So as well as the grants and subsidies that I mentioned earlier, we're keen to support women in PH. For the last 2 years, we've had brilliant women's events at Congress to inspire, to share experiences, help women researchers and doctors make those crucial contacts so they have a support network around them, and enable them to more easily take that next step in their careers in what's quite a challenging environment, really. And we're also doing more early career work. So for the first time in Rio, we had an early career event, which was a huge success. There was the venue that we were staying in made a little bit of a mistake about when we wanted the bar. And so the event had a bar, and I think that made it a lot more popular. So we've had a lot of demand to do that again next time. So what the idea of that meeting was, it was a sort of speed mentoring meeting. And it also enabled us to take a reading of what the needs of early PH career doctors, physicians, academics are. We are very, very keen to make sure that PH pipeline, the workforce pipeline, is sustained and supported. So the more we understand about what their needs are, the better we can meet them. So we've got some quite exciting things planned for early career support over the next few months and years. So there are too many talks to tell you about, but the scientific sessions, all the recordings of all the presentations from Rio are available to our members on our website. But we also just recently put a selection of recordings of these on a platform called ViewMedi, and you can see the link there on the slide on the right. This is a free platform. It's an American platform aimed primarily at the medical community. But you can sign up. You can log in there, and if you search on PVRI, all our talks will come up. Some of them are super scientific and completely beyond me. I'm not a medical person. I'm not a scientist or practitioner. But there's some really interesting, accessible stuff on there too. I mean, there's I would point you to the digital twin talk on there, which it's fascinating. It's really interesting. So yeah, do have a look if you can. And if you're a member or want to become a member, you can access all the talks and presentations, not just from Rio, but from previous PVRI meetings as well.
Can patient organizations become members? Sorry to interrupt. Can patient organizations become members?
Yeah, I mean, we usually have membership is for individuals rather than for organisations. But I mean, we do work closely with patient organisations, and we invited 4 here. You can see them here to exhibit and have stands at Rio. We work really closely with Matt and the PHA, and we have a memorandum of understanding, so we support them. And at the Rio Congress, there was one of the presentations given was a joint presentation, PVRI and PHA. And it's sort of they reciprocated at their last meeting as well and did a PVRI one. So we're amplifying each other's voices and promoting each other's work. So we're really happy to work in whatever ways we can. But the membership per se it's more for individuals. So that's our patient organization support. Our next meeting is coming up in Amsterdam. It's the Drug Discovery and Development Symposium. It's a shorter meeting. Our Congress meetings usually are 4-day meetings, so there's an awful lot of scientific content in there. This is 1.5 days, but really, really interesting program. Lots of time for discussion. It's going to be fantastic. I'm really looking forward to it. And again, you can find out information about that on our website. And finally, before Dublin next year, January is our slot on the PH calendar. So we're really excited to be in Dublin, and we've got Sean Gain putting together a committee and developing a programme for that meeting. So yeah, really exciting stuff happening at the moment. I think it's quite an inspirational time to be in PH. So yeah, and if I can just finish now by thanking all the people who are involved in our network. We have a very small staff team in London, 6 people, and we exist to support the work that the community does. And by supporting them to come together, I think it's a really effective way of working. I mean, just bringing all these great minds together in one room just produces some quite inspirational results. So it's a delight to work with them all. And if any of them are here, well, I know people like Ardi is here and Sandeep and Matt, I'd like to thank them because they're the lifeblood of PVRI. So my email is there. If you think that there's any way that we can help you, please get in touch. We'd be, it would be great to talk to you.
Amazing. Thanks so much, Karen. That was a very good presentation. And I mean, you touched on a lot of different things, but yeah, you gave us a good flavor for all the excellent things that you're doing. And I didn't know your organization so much before, but definitely have quite a good idea now. As much as possible, when you were mentioning like the Dublin meeting, I was trying to put the links in the chat, but I think those that might look back over your presentation too can easily find those on your website. Very nice website, by the way.
I mentioned social media. We've got loads. If you just if you're on X or Blue Sky. In fact, we're not quite on Blue Sky yet. We're just about to join Blue Sky, but yeah, you can find us on there too. So the info's there.
Yeah. No, we just had a few comments. Thank you for the resources. Thank you for your clear presentation about PVRI. Thanks. PVRI was a really great conference in Rio. So yeah, some attendees were there. Excellent. And before we go to Ardi talking about the registry, I had one question myself. When I was thinking about the global reach that you have, are you seeing any strategies, successful strategies or methods or ways to address pH in low and middle income countries where, awareness is low, resources are low, maybe patient access to treatments are low. What can be done in those situations right now that is working, if you've seen anything?
It's really interesting. I had a fantastic meeting with some great people who want to get things going in Sri Lanka just last Friday, and they were asking, well, what's the blueprint? But how do we do this? And I had to say there isn't a blueprint, because every country, every healthcare system, every patient population is so different that I would love to give people kind of a map for, this is what you do, this is how you do it. But I mean, we are developing a bank of learning. So, for example, I mean, we can help with grants. We can help with perhaps exchanges. We can help them by accessing funding on their behalf to enable some of those exchanges to happen. Those are the sorts of things we're talking about. We're also able to pull in expertise from really senior people who can address some of the learning needs of the professionals in Sri Lanka. There aren't many PH professionals that, people don't have skills there. There's very, very little cath lab access. So the diagnosis is stuck. So where we look likely to start perhaps is by seeing if we can get people trained up in echo, because that way at least, we'll start to develop a pathway through. So the very, very few cath lab places that are available can be used, to target the most high-risk people. So little by little, really. And I think, but I was told, I did have to make the point, we don't have that much money. So the grants that we can give to organizations, they're relatively small, they're sort of 10,000 to 10,000, but they were saying actually that makes a difference. In Sri Lanka, you could do a lot with that. So yeah, so I'm really excited to see what's going to happen. We might have a new task force coming, but
sounds like
that's a long answer.
Times ahead, and as you said, just bit by bit, that's the way to do it. No,
Yeah.
thank you, Karen, for joining. Yeah, it was lovely.